Germany could soon impose stricter coronavirus restrictions. Chancellor Angela Merkel is due to meet leaders of the country's 16 states. Partial lockdown measures were introduced only 2 weeks ago, closing bars, restaurants and museums. Despite this, new cases have not dropped significantly. According to the German Public Health Authority, new infections rose by nearly 11,000 on Monday. Joining me now for more is DW Chief Political Editor Michaela Küfner. Michaela, what can we expect from today's meeting there?
Well, we can definitely expect tighter measures. We've had access to the draft document, and there it states that although Germany has managed to get out of an exponential phase of reinfections and infections rather, this is seen as a small success, but also seen as not enough to prevent the German health services from being overstretched. Intensive care units are up to 70% and sometimes beyond capacity. And that's why Germans have to brace themselves for yet more contact restrictions. Clearly a focus on how many people meet each other at any point in time. One of the proposed measures there is that when people meet in public, it's no longer just 2 households that are allowed to meet. It's only 1 person allowed to meet with 2 members of another household. So more restrictions there, and a call for absolute minimum contact, also including requirements for masks in schools. There's been very different pictures according to which region in Germany you speak of. So more to come for the German public, which is increasingly concerned that this disease might actually personally affect them.
A pretty grim outlook. In an interview with Germany's Bild am Sonntag newspaper, Germany's economy minister Peter Altmaier said he expects that Germany, quote, will have to live with considerable precautions and restrictions for at least the next 4 to 5 months. Germans have been told that we have a lockdown light for 4 weeks, now this. What's your take on that?
Well, that pretty much tails in with the timeline that seems to be crystallizing out of this very promising prospect of actually having vaccinations within reach over the coming months. There's an expectation here by the company BioNTech that is producing this vaccine that it could be ready to go at the beginning of next year. And by the time this is able to reach enough people to make a real difference, that could be a couple of months from now. Health authorities for now are being told that they should be ready to start mass vaccinations by mid-December already. So clearly preparations on the way there.
I want to talk about a new campaign launched by the German government. It's called Be a Hero, and is essentially encouraging people to stay home and be couch potatoes. So let's just check it out. This version is subtitled by an English Twitter user. Let's have a look.
Eine unsichtbare Gefahr bedrohte alles, woran wir glaubten. Und das Schicksal dieses Landes lag plötzlich in unseren Händen. Also fassten wir alle unseren Mut zusammen und taten, was von uns erwartet wurde. Das einzig Richtige. Wir taten nichts. Absolut gar nichts. Waren faul wie die Waschbären. Tage und Nächte lang blieben wir auf unserem Arsch zu Hause und kämpften gegen die Ausbreitung des Coronavirus.
That's, of course, a spot by the German government seeking support for strict coronavirus measures. After all, Germany is a country that has seen some of the biggest anti-lockdown protests here. Do Germans really have the stomach for more restrictions?
Yes, they do. Some 3/4 of Germans see the current restrictions in place as adequate, and some of them even feel that they should be even tighter. So for now, Angela Merkel has incredible support. It's been rising throughout this crisis, and Germans do have the stomach for it now, although there is a very small but very loud group that is firmly against these restrictions. I think the clip there, most of all, is proof, if we need any, but we often do, that there is a German sense of humour also when it comes to the public authorities. And it's a very tangible example that the focus focus when we see new restrictions being announced today is once again more on the individual's responsibility and not authorities being able to control something like how many people meet at any one time. So it's the firm message that the onus is on every individual to ensure that this doesn't get out of control.
Our Chief Political Editor, Michaela Kübner. Thank you, Michaela. Coronavirus testing labs have long since reached their limits in Germany. In an attempt to ease the pressure, a new strategy is in place for the winter now, with fewer tests but targeted at those who need them most, and also more rapid tests. But the new strategy comes with challenges, as we discovered at one hospital in Berlin.
A coronavirus test to make sure this patient's not infected, ahead of her operation in a few days' time. It doesn't hurt exactly, but it's very unpleasant. It feels like the swab is poking around in your brain. The test is obligatory to protect other patients and staff at hospitals like this one in Berlin. But many people in Germany would like the chance to be tested more regularly. It would be good if we could use the tests to make things like travelling easier, to be a bit safer. That doesn't look likely anytime soon. With testing capacity at its limits, the government is trying to ease the pressure on overworked labs. Even some hospitals are shifting away from the more reliable PCR tests, instead using the faster, cheaper antigen tests to check their staff for the virus. The advantage of rapid tests is that we get a result within 30 minutes. It's relatively reliable and a relatively easy testing system. But on the other hand, the disadvantage is that we know the rapid tests are slightly less sensitive to the virus. The PCR test is the gold standard. It's more precise than the rapid test. It's a fine balance between what's reliable and what's practical. But the rapid tests come with their challenges too. In Germany, they can only be administered by a trained health worker. That costs time and money and means people can't test themselves at home. Nurse Yves Bormann understands the dilemma. As hospital staff, of course we would have liked to keep using the PCR tests because they're more sensitive. But I understand that the labs are at their limit and we need the PCRs more urgently for the patients. When they arrive with symptoms, then we have to know fast, but for sure, whether they really have coronavirus or not. Bormann gets tested once every 2 weeks. Enough to feel safe, he says. But it's clear any hopes testing could be rolled out on a broader scale will have to wait. For many, that means a test of patience instead.
Let's take a look now at some of the other developments in the global pandemic. The United States has now surpassed 11 million cases. That's the highest number in the world, despite the US having less than 5% of the world's population. Starting Thursday, New Zealanders will have to wear masks on public transport in Auckland and planes nationwide. This comes after several small outbreaks in Auckland. And authorities in South Australia are warning of a dangerous situation after a spike on Monday, followed months without any locally acquired cases. Over the weekend, Lebanon began a 2-week lockdown to curb the spread of COVID-19. Health officials called the country's situation critical, with hospital capacity at a saturation point. But many dread the economic impact of the restrictions, as the country already faces its worst financial crisis in decades.
Lebanon enters another lockdown. The few people out on the streets of Beirut are wondering how they are going to make ends meet.
I'm basically not going to work for 2 weeks. My salary in the next month is going to be like so low. So I don't know.
The country is registering around 2,000 new coronavirus cases every day. And its intensive care units are at 95% capacity. That's prompted the government to urge people to put their health first and not the economy. We have reached the red line. We've reached a stage of critical danger. And we dread reaching a stage where people are dying in the streets. Authorities hope that this lockdown will give the country's health system a chance to recover. But not everyone is convinced the restrictions will make a difference.
Many people are coming to the pharmacy having corona, and they are not committed to the lockdown. They are going they are going outside without face masks, so we need to be more committed.
Others are respecting the lockdown rules, but with Lebanon's hospitals short of hundreds of doctors, the country likely has a rough road ahead before it can get a grip on the pandemic.